This medication is used to prevent or control bleeding in people with little or no factor IX, which is a protein in the blood that helps the blood clot and stop bleeding. People with little or no factor IX are at risk for bleeding longer after an injury or surgery, or bleeding suddenly without an obvious cause. It should not be used to reverse the effects of blood thinners, and should not be used to treat other types of factor deficiencies or problems. If you are using this medication, consult your doctor or pharmacist to make sure that you are using the right product. This medication is administered through a vein injection as instructed by your doctor. The dosage will depend on your medical condition, weight, and how you respond to treatment. Before using the medication, gently mix it by swirling, but do not shake it. Some forms of this medication need to be completely mixed into the liquid to ensure there are no particles. If you notice particles in the liquid, do not use it. However, if there are a few small particles in the vial, it should not affect the medication's effectiveness and can be removed by a filter. If you have any concerns about using the medication, consult your doctor or pharmacist. If you are self-administering this medication at home, make sure to learn the preparation and usage instructions from your healthcare professional. Also, learn how to safely store and discard medical supplies. The medication in the vial and the supplies should only be used once and should not be reused. Inform your doctor if your condition persists or worsens. Some common side effects of factor IX complex include pain at the injection site, chills, tingling, flushing, headache, nausea, or vomiting. However, many people using this medication do not experience serious side effects. If you do experience any serious side effects, such as swelling at the injection site, fast heartbeat, or signs of kidney problems, it's important to notify your doctor right away. Very serious side effects are rare, but if you experience symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. Before starting treatment with factor IX, it is important to let your doctor know if you have any allergies to factor IX products or any other allergies. This medication may contain inactive ingredients that could potentially cause allergic reactions or other issues. Inform your doctor about your medical history, especially if you have other clotting disorders, heart disease, immune system problems, recent surgery, or liver disease. If you are planning to have surgery, make sure to inform your doctor about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that this medication is made from human blood. Although the blood is thoroughly tested and the medication undergoes a special manufacturing process, there is a very small chance of getting infections from the medication, such as viruses like hepatitis. Consult your doctor or pharmacist for more information on this. If you are pregnant, this medication should only be used if clearly needed. Make sure to discuss the risks and benefits with your doctor. It is not known whether this medication passes into breast milk, so consult your doctor before breastfeeding if you are using this medication. When taking factor IX complex, PCC, number 4, 3-factor solution, Reconstituted, Recon Soln, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. This medication may interact with drugs that help with clotting, such as aminocaproic acid and tranexamic acid. Be sure to discuss any potential interactions with your healthcare provider. If you suspect an overdose and observe severe symptoms like fainting or difficulty breathing, it's crucial to seek immediate medical assistance. In the U.S., you can contact your local poison control center at 1-800-222-1222, while Canadian residents can reach out to their provincial poison control center. Remember, it's important not to share this medication with anyone else. It's also important to have regular lab and medical tests, such as factor IX activity, while using this medication. Make sure to keep all of your medical and lab appointments and consult your doctor for more details. Make sure to take each dose of factor IX complex, PCC, #4, 3-factor solution, Reconstituted, Recon Soln, as directed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule immediately. Do not take a double dose to make up for the missed one. Be sure to follow the product instructions and consult your pharmacist about how to store factor 9 Cplx, PCC, #4, 3factor solution, Reconstituted, Recon Soln. It's important to keep all medications out of reach of children and pets. When it comes to getting rid of this product, make sure not to flush it down the toilet or pour it into a drain unless specifically told to do so. Instead, properly discard it when it's expired or you no longer need it. Your pharmacist or local waste disposal company can give you guidance on the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.